If the Supreme Court upholds the law, is the implementation going to happen on schedule?
The issue that I think is not going to be ready is the money. I mean, that's really what you get to. If you have 9% in GDP deficit and you're looking next spring at what's likely to slow this down, let's assume the Supreme Court upholds it. Let's assume Congress has a similar makeup to today, and let's assume that President Obama gets reelected, all of which are wildly, interrelated assumptions, but I think those are the most likely outcome. You're going to have a massive budget deal next year. There's no way around it. And you're going to have to redo the tax code, which in itself is a nightmare, and raise revenue. You're going to have to cut defense spending. You're going to have to massively cut Medicare and Medicaid, except that there's one moving piece that takes all that pressure off, and that's to say we all want to do universal coverage. Some Republicans may not be, but they're not going to be able to repeal the thing. We all want to do the right thing, but guess what? 2014, we can't do it in this deficit environment. And so I think in a big mega deal, to me, the obvious pieces are the Republicans agree to, read my lips, we're raising taxes, which they're not going to want to do, but they're going to have to do it to some degree, and which is their holy grail. And the president's holy grail is the health care bill. Well, the pieces of a big deal to me are higher revenues. You're obviously going to cut defense, but the real trade-off is you're going to really cut Medicare and really cut Medicaid for beneficiaries that raise co-payments, raise deductibles, move the retirement age to age 67, all of which should happen, all of which probably will happen. But the big pressure relief valve is a deal is to say, which Republicans I'm sure will push for, let's not do this in 2014, let's do it in 2015, and let's phase it in over more years. I don't think they'll be able to downsize the benefits any, but I do think that the obvious pressure relief valve is the massive amount of money you're going to spend on this health care bill.
So if the Supreme Court strikes down the health law, what should Republicans do then?
Well, I mean, the reality is, what should they do? They should come back with a scaled back version of, states' rights with some subsidy and some exchanges with subsidies and a catastrophic benefit and a much more streamlined benefit. That's what they should do. I think the reality is there's been enough venom, maybe non-substantive venom built up about this. So the reality is, I think nothing will happen for years. I mean, people talk about various things, but if the bill gets struck down, it'll be a decade.
Are there pieces of the law, if it's struck down, are there pieces of the law that are worth salvaging and could potentially be salvaged?
Well, my own personal view, and I've been this forever. I mean, the George Bush 41 plan, first President Bush had effectively exchanges, insurance reforms and exchanges. Along with refundable tax credits or transfer payments to insurance companies to pay for basic benefits are all a good idea. The issue is how much and at what level, and how much federal structure do you impose, how big are the subsidies, how many people are covered. So the basic construct of what President Obama was trying to do, I personally don't have a problem with. The issue is the magnitude, the size, and the spending, and I think that all got out of control. So do I think people should get back to that? Yeah, I've been advocating that for 25 years, as you know. But I would have done probably the Obama light plan, which, with a lot less subsidies. You can debate the individual mandate and how you structure it, which should be state by state. But, exchanges with transfer payments for people for an appropriate policy that's not a overblown policy for the right number of people. I think bringing the subsidies to 400% of poverty was unrealistic from the beginning, and I just don't think, personally, I don't think that's sustainable.